Welcome, welcome, welcome. My name is Dr. Vivian Okoye, and I am the host for this webinar. I am a volunteer at Afrikindness, and I lead the neurodiversity and inclusion at Afrikindness. And this evening, we're here for the second part of a 6 webinar series that we have put together. And this 6 webinar series is actually focused on creating awareness to bridge the gap in knowledge and in support as it regards neurodiversity, autism, ADHD, all of the neurodiversity in our community, which is the African and ethnic minority community, especially in the United Kingdom. And this 6-part webinar series is part of our Afrikindness Neurodiversity Community Program. You know, that program is a whole program, and this webinar series is actually part of it. And today is the second part. We did the first part last month. It's a monthly webinar series. So we have webinars on different topics as it relates to neurodiversity every month for the next 6 months. This is the second one. And this specific webinar is focused on addressing how to manage challenging behavior, how to understand and manage challenging behavior, especially in neurodiverse children. And we're doing this because we understand the immense challenge that it can be, to manage behavior, to even recognize the behaviors that are challenging, to recognize and associate those behaviors to neurodiversity, and then to understand how to manage it. Right? Challenging behavior can be very difficult, whether you're a parent, whether you're a teacher, whether, as far as you work with children. If children are exhibiting challenging behaviors, it can be very, very overwhelming, So when it comes to a child who is neurodiverse now, it's even more challenging. So we aim to, bring you some tips, knowledge, and some strategies that you can use, whether you're a parent, whether you're a teacher, as far as you work with children, as far as you have contact with children, usable knowledge, usable tips, and usable strategies that you can use to navigate those challenging behaviors and to actually navigate them effectively in a way that is empowering for the child as well. Because whatever we do, especially in Afrikindness, our focus is ensuring that the children in our care are living a life that is worth living, that they're being included, that they're being supported, and they're being able to function and thrive wherever they find themselves. So we have really amazing people with me this evening. I'm hosting the most amazing people to deal with this topic. And as you can see, the beautiful faces that we have in here, different people from different backgrounds with knowledge. These are people who have worked with children, who have different experiences, and they will be sharing from their experiences. They're not just sharing book knowledge. They are sharing from the experiences that they have gathered over the years of working with children and supporting children who are neurodiverse, right? So first here is Blessing Ngiape. Blessing is an international dyslexia teacher of the year. She's an internationally certified special needs educator and dyslexia coach. Renowned for her expertise in neurodiversity, she is the founder of Dyslexia Help Africa, and executive director of Dyslexia Help Learning Academy. She holds certification from Cadet Academy and IBCCES and has specialized training from Nursery Learning. Awarded Dyslexia Teacher of the Year 2021 by Dyslexia Trust Nursery UK. She's also a Future Awards Africa nominee and Inclusion member. Blessing empowers educators, consults for schools, and organizes seminars to raise dyslexia awareness globally. So please help us welcome Blessing as she is one of our panelists for this conversation this evening. Welcome, Blessing. It's
Thank
amazing to have
you.
you.
Thank you,
Thank you for
Dr.
joining
V.
us.
It's
The
good to be
next
here.
person, thank you so much. The next person I'll introduce, who is also one of our panelists, is Lovett Moye. She is Lovett is a volunteer for Afrikindness. She's one of our, you know, top hands in Afrikindness, our volunteer, our special person. Lovett is a seasoned educator with over 2 decades of experience in the UK. Starting as a French teacher in 2021, she has held roles such as advanced skills teacher, director of learning, and assistant head teacher, holding dual MAs in linguistics and sociology of language from France and an MA in educational leadership from the University of Nottingham. Ms. Moye emphasizes holistic student development, integrity, and empathy. Beyond education, she volunteers at her local food bank, fostering community cohesion and welfare. Welcome, Lovett. It's amazing to have you share, over 2 decades of experience working in the school, working with children from diverse backgrounds. Thank you for bringing that expertise to this conversation. I'm really excited to host you. And then the last but not the least is Oluwadamilola. um, she is the first qualified autism service practitioner service in Nigeria, registered behavior technician, certified United People Global Sustainable Leader with a background in psychology and a postgraduate diploma in education. She has built her career around making a meaningful difference in the lives of children who need specialized support. Through extensive training and certification, including becoming an international behavior analyst and a qualified autism service provider, practitioner supervisor, Oluwadamilola has honed her skill in applied behavior analysis and other evidence-based practices. Welcome, Oluwadamilola. She with us. I saw her a few minutes ago on the screen. I hope she's in. Dami, are you here?
I'm here. Thank you so much, Dr. Vivian.
All
I'm
right.
here.
It's good to have every one of you. And I'm really looking forward to this conversation because I know even my own children, I don't have anyone who is diagnosed with neurodiversity, but I know how difficult it can be to actually handle challenging behavior. I work with children who are on the spectrum, and I know how overwhelming it can be for practitioners. Then talk more of parents who don't have the expertise to actually handle such behavior. So I'm hoping that by the end of this conversation, that everyone who is here has something to go home with. Like if you're a parent of a neurodiverse child, you would have something to go home with, something that you can start practicing right away. If you're a teacher, you would have something that you can start doing right away to make your classroom experience feel better for yourself and for your children. And please, I also want to encourage us to stay, and listen. And if you have questions, put them down. At the end of the webinar, we will take your questions and we'll be able to answer them. You have the four of us to be able to address your questions. So stay and ask your question. We have somebody in the chat to take your question. If you're streaming and joining us on social media, drop your questions in the chat. Someone will pick it up. Also, please don't leave until you hear our announcement because we have really amazing announcements that you will benefit from at the end of this program. Please ensure that you stay till the end so that you don't miss out on those announcements that will come at the end of this program. So getting into the program. So I'm going to ask our panelists questions that are targeted and then they would respond to us, right? So I would start with Blessing, right? Blessing, I don't know if you're ready for me, right? So we will start by just really not assuming that everybody understands what neurodiversity is. So my question to you is for you to help us explain in a layman language. Explain to me as if I'm a 5-year-old what neurodiversity is so that everyone in this room can understand what it is, what we're talking about.
All right. Thank you so much, Dr. V. for having me. I actually was looking forward to starting with Lovett first, because I just
Oh,
love her calm voice. And I was just like, oh, let me hear that calm voice first. But then here we are. Well, definitely, I know she'll still touch on this. I'm going to define it in a way a baby can understand, and then Lovett is going to add more to that. So when we talk about neurodiversity, I always love to, first of all, let people understand that when you look at these kids, when you look at kids with autism, when you look at kids with dyslexia, when you look at kids with learning difficulties and what we term as special needs, you need to first of all look at it from the fact that their brains are functioning differently. It doesn't mean they are functioning wrongly. Because most times when you talk about special needs, the first thing is, oh, something is wrong with this child. Oh, does this have a cure? So when you look at these kids, the first thing you need to realize that just as the word says, neurodiverse, people's brain are formed differently and people think differently, people function differently. When I'm talking about educators, I'm always saying, no, this child in your class that you say, oh, he's struggling, I can't help this child. The first question is your lesson plan. Is your lesson plan created in such a meet the needs of diverse learners? Because when you come into a class, most times you have educators, especially where I am currently. You come into a class with a lesson that just goes one line. It's a lesson you prepared based on how you perceive that this child will learn. But you need to prepare a lesson that is diverse because you have different kids in your classroom that function differently and learn differently. So, in a layman's language, in explaining neurodiversity, is understanding that people's brain function differently and we learn in diverse ways. And it doesn't mean something is wrong with them. It just means there is a way process in which we need to connect with. Because most times we are looking more at the kids changing. Oh, learn the way I am teaching you. But how about you trying to create creative ways that they can learn the way their brain was functioned to? So I hope I've been able to explain that for a layman.
thank
Thank
you.
you.
Thank you so much. Yeah, that was really, really in-depth and, expository. And I like the fact that you said, we, instead of just focusing on changing, this person or this individual or this child, why don't we look at them and say, what does this child need from me? How can I adjust, to suit, the needs of this child? Right. And for anyone listening, right, yeah, someone in the chat says respecting differences. For anyone listening, just the way the color of our skin is different, our face is different, our facial features are different. That's the way our brains are different, things differently, respond to situations, to sensory situations, stimulations differently, responds to information differently. So imagine if someone came to you just because you look different from them and they say, oh, something is wrong with you just because you look different from them. You would obviously be taken aback and feel offended, right? So that's the way it is for neurodiverse people. It is not that something is wrong with them, it's just that they're not processing information the way typical people process information, and some things that affect them or some things that do not affect you affect them. So really, really is just understanding that we're all different and finding a way to accommodate our differences and ensure that everyone is thriving, wherever we find ourselves, especially children who cannot help themselves as much. Really, really important, right? So the second question goes to Lovett and Damilola, but I'll start with Lovett, right? And that question is, what are the common behavior challenges that are associated with neurodiversity, right? So what I mean by this is, when we talk about behavior challenges, any child can have behavior challenges, right? Are there specific behavior challenges that we would see in our children, and it should pique our interest to say, is there something going on here? Is this associated with neurodiversity, because sometimes the behavior challenges might even be the first thing you pick up that will then prompt assessment or diagnosis. So are there peculiar challenges that are associated with neurodiversity?
Dr. V, thank you so much. Good evening, everyone. Good evening. I just want to add something to what Blessing said earlier about neurodivergent students. Regardless of their age, the fact that is that they process information differently. The way they process information, the way they receive information, the way they interpret information is different. It's what they call sensory processing challenges, differences for them. And that's one of the challenges we see in the classroom setup. And what a teacher who deals with so many other needs in the classroom sees, picks up immediately, is the fact that this child is not processing this information accurately. And they may have slight delay in the way they process information because of their sensory processing differences. And then also there's something we call executive function skills that neurodivergent students struggle with. Sometimes, not all the time, but there are some specific executive function skills that they struggle with. When it comes to their cognitive skills, their ability to control their impulses, and then the working memory. We're going to look at strategies later on afterwards, strategies that teachers normally use in the classroom to support with that. So when it comes to challenges, another challenges that we encounter in the classroom, it's organizational skills. They may have difficulties actually organizing themselves, and they may have challenges, time management, and also delay in their metacognitive skills in the way, again, like I said before, they process information and they actually explain. So that does not mean that they are less able than the rest of the students in the classroom. Actually, I have had the privilege in 23 years of teaching in the United Kingdom and in different school settings of working with the most intelligent and smart autistic students, really, really able students. It's just about understanding the challenges they're facing in terms of processing information, but they are very articulate, very, very intelligent. And then attention deficiencies, some of them have difficulties controlling themselves. We call it inhibitive control. They can't sit still, like in the primary school setting. You hear the teacher saying that child cannot sit still in one place. They're very restless. Again, it's part of the challenges we face in the classroom. And sometimes they have poor concentration span and attention span as well. They may have literacy and or numeracy difficulties. And some of them may have some health-related challenges like eating disorders. That doesn't mean that it's only eating disorders that only occur with neurodivergent students. That's not true. We know that. But some neurodivergent students may have some health-related issues as well. They may have low mood. They may have communication and language difficulties as well that we have to be aware of. And again, I've talked about their cognitive skills that, especially when you're talking about autistic students, when it comes to transitioning from one activity to another, they may find that challenging in the classroom setting, and that can actually trigger a whole set of challenging behavior and tantrum in the classroom that the teacher may not be able to handle. Thank you.
Yeah. Thank you very much. That was really, really, really in-depth. And, and if you're a parent who is listening and you're hearing classroom and teacher, just switch those to home and, in your house, because, if Lovett is speaking from a classroom perspective, whatever happens in the classroom can equally be happening at home, right? And, one of the things that Lovett said that actually caught my attention is that you want to understand. And even if you're listening and you're not a teacher, and you're not a parent of a neurodiverse child, because we're doing this as a community awareness, what we want to educate our community so that even if it isn't your own child, when you see another parent struggling or another child struggling, you're able to show empathy and you're able to at least know what to do to support or to provide a safe space for that person in that moment of need, right? So one of the things that we want to stick in our head is to understand that neurodiverse individuals or children are not disabled. They are differently able. right? The way they process information is different. The way they receive information is different. As Lovett was explaining, some of those challenges in processing information, some of those attention deficiency, and some of those organizational skill. As a parent, I'm thinking and I'm like, a child can be exhibiting some of these things at home, and then we're labeling them, and then we're shouting at them, you're clumsy, you don't listen, you don't stay at a place, you're not focused, without even realize. And I'm speaking to people who may not have had access to diagnosis, or who may not even have realized that their child might be struggling with something much more than the behavior that they're exhibiting. So it's really not to be quick to judge or to label your child, but to really think and ask yourself, what is really going on? What does this child need from me? Is there more going on than meets the eye? Do you understand? So thank you so much, Lovett, for that question. Dami, do you want to add anything to that?
Sure. I would just like to highlight some things in addition to what Lovett has said. Impulsivity. You can see a child who frequently interrupts others during conversations or acts without even considering the consequences. Like a child running into the street without checking to see if a car is coming. That's one of challenging behaviors that we experience in neurodiverse individuals. We could also talk about sensory sensitivities. A child that is being overwhelmed by loud noises, bright lights, and these things could lead to meltdowns or a need to withdraw from the environment. And then you're wondering, what's the big deal? Why are you walking away from the boat, not knowing that the noises, the lights, and everything that we think is fun is overwhelming for this child. We could also think about social interaction challenges. A child who has some form of social communication disorder would definitely have difficulty interpreting social cues, right? Because of that, there will be misunderstandings or conflicts with peers. We've seen that happen with our population over time. These are part of the challenges that they experience. Repetitive behaviors is also something that we see, like rocking, hand flapping, repeating phrases, and then you see a child watching a program and would only want to watch a particular place. Once they're done, they take it away from that place again. They'll be watching. Those are some of the behaviors that are challenging for our children. Communication difficulties too is something, because some of them could have language processing disorder. So because of that, they find it challenging to understand or express themselves verbally. This could lead to frustration or withdrawal from conversations altogether. Some sensory seeking behaviors as well, right? A child is constantly seeking sensory input, such as spinning, jumping, touching objects, or a child is just watching the fan rolling. All of these things are kind of sensory feedback that a child is seeking from the environment. So these are some of the other challenging behaviors that neurodiverse individuals experience. Thank you.
Thank you so much for that input. Thank you. I have another question for you, right, Dami? And it's because we are speaking to African and ethnic minority, whether you're African, whether you're Caribbean, whether you're Asian, our culture is somehow related in terms of parenting, in terms of the need for respect, the expectations of behavior, right? So when we speak about some of these challenging behaviors, some of them, speaking to this culture, some of them are associated to poor parenting. Some of them are associated to stubbornness, right? How can a parent or a teacher differentiate between when a child's behavior is actually stubbornness, or maybe gaps in parenting, and when this behavior is actually associated with neurodiversity, right? Can you provide us with any guide as to how we can make that differentiation?
For sure. First of all, it requires a nuanced understanding of the child-specific diagnosis, right? And then the context of the behaviors. Yes, you mentioned that there are some parents who might not have access to diagnosis. So I'm just going to say it this way. For neurodiverse triggers behaviors, for instance, they are often triggered by specific stimuli or situations that overwhelm the child. So it will be specific. If you look at the pattern, there will be a pattern to the behavior, something specific, is it similar or situations that are overwhelming to the child. It could be as a result of sensory overload, changes in routine, or difficulties in processing information. So if a child is having meltdown every time you go to a supermarket where they always play music, and every time you go to this supermarket, this child is always having some meltdown and the likes. If you take note and you start looking at the things that are in the environment, here it is a specific stimuli, and then there is a consistency in the behavior that the child is expressing. That way you would know that, okay, this is not a child just not well trained, but this is something to look out for because there are specifics to it, and there's a pattern into it. But for a child that is just some children will just be consistently testing your boundaries, for instance, right? Or reacting to frustration in a way that is more typical of their age, because there are some behaviors that are age bound. And maybe this is just what the child is in. But for a neurodiverse individual, it has to be specific. They're reacting to some specific stimuli, and there is a consistency in the reactions to some of these things. Also, patterns of behavior, which is something I've kind of touched on. It has to be consistent across environments, right? Maybe every time a child gets to this place where there is water or something, the child starts screaming, the child starts. If you notice it, that every time we get to this point, this is when a child exhibits this behavior. That's more common with neurodiverse individuals as against neurotypical children. So it has to be context specific, right? And then response to interventions also is something we should look at. For a neurodiverse individual, for instance, it will require particular strategies. It will require some form of support to manage behavior, not the typical disciplinary measure. So if you have used the typical disciplinary measures and they are not giving the desired results, then that's something to look into. It's more likely that it's not because of poor parenting. It's not because you have not done what you're supposed to do. You have done all that you are supposed to do, but this child is still exhibiting this behavior. Then there's more to it that you need to check on. A neurodiverse child may not respond to being grounded. You understand? But will probably benefit from structured routines and sensory builds. You've grounded the child, you've put the child in timeout, you've taken away their toys, and they're still not responding to all of these things. Then that's a sign that it's beyond poor parenting or like. And then communication difficulties is another thing that you would notice. A child with neurodiversity might struggle with communication, leading to frustration. So it's some of the behaviors that a child with neurodiversity is experiencing is probably because they are not able to express themselves. You're asking them what's going on, what do you need, and they can't tell you the way exactly they feel. And because of that, they are acting out a certain way. If you also look at the pattern, you'll be able to tell, oh, every time this child is not able to tell me this, they engage in these behaviors. That way, you'll be able to tell the difference between behaviors that are associated with poor parenting and the ones that are because of a certain kind of diagnosis. And then if some behaviors are consistent with no diagnosis, right? Concerned with not what is known about that condition of the child, it is more related to neurodiversity than poor parenting. For instance, a child with OCD may engage in repetitive behaviors that they cannot control. Maybe, in my experience, I've seen a child who will constantly go to close the door if someone else opens it. No matter how you say, oh, don't go to the door, stop, the child will keep going to the door because it's something that the child needs to do to be able to feel great in whatever environment they are. That has nothing to do with poor parenting. You will know that this is some form of OCD that a child is expressing. Really, if you're looking at behaviors that could probably lead to other things that are not neurodiversity, they will not be consistent. But for behaviors that are related to neurodiversity, there is some form of consistency in it. It is context specific. It is there is specific stimuli that is eliciting those behaviors. So if as a parent, you are experiencing some certain behavior, you want to look at the context in which this behavior is happening. You want to look at the setting of the environment in which this behavior is happening. If it is consistent over time, then it is something to look into. It is likely that this child or this individual is a neurodiverse individual. Thank you.
All right. Lovett, I see your hand is up. Do you want to say something?
No, actually, Blessing, that was so very detailed. Thank you. I just wanted to add something that we notice in schools that parents may also notice at home, with many of our neurodivergent students, and they find challenges with their working memory. They find it difficult to remember or recall a long set of instructions. So when you're giving them instructions, even at home, do this, da 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 da, and we've just and we think that's it done. I've told you that over and over again. The child needs the information broken down into smaller steps and with clarity. And sometimes maybe worth going through each instruction with them step by step to make sure that that is clear, giving them time to action those before moving on to the next. But we expect immediate action from them, and we lose them, and they go into tantrums, and then they start exhibiting some of those challenging behaviors that we see in school and parents also encounter at home. Breaking down information for them helps. Another thing we notice in school is transition. Neurodivergent students find transitioning very, very challenging, either whether it is from nursery to key stage 1, or whether it is from key stage 2, year 6 into year 7. Or even if they are working in a school setting where you have the lower school and the upper school, and then they have to go from year 9 into year 10, they find that challenging. In the classroom, transitioning from one activity to the other, they may find that challenging as well without talking to them first about it. So what we say to teachers is, okay, before we do the transition, the activities, the planned activities, tell the students, okay, next lesson, class, we're going to be looking at A, B, C, D, just to prepare them. And these are the resources to help you. Let's go through that together. Where do we find them? Breaking down information, chunking them into smaller steps for them. And they don't deal very well with surprises, if I could put it that way. So giving them just activities like that on the spur of the moment, but preparing them helps. And we say that to parents, if your child is in year 6 going into year 7 and you're looking at secondary schools, visit secondary schools with them, do a couple of visits with them, speak to the school Senko. I'll talk more about that later. Speak to the school Senko, look at the school facilities, look at the route to school and some of the things. They may know some friends already there, or just to familiarize them with their new environment should they choose to go to that particular school. So the same thing happens as well when we are transitioning from one activity to the other, or transition of any type at all. They find it, and it creates stress and anxiety for them that could be avoided. Thank you. Or minimized.
Thank you so much. Thank you. Blessing, do you want to add anything to this particular question?
Okay, no, because Lovett has already covered, especially the classroom area. Thank you.
All right. All right. Thank you very much. All right. The next question is for you, Lovett, actually. And that question, I felt like you've touched a little bit about it, but the question is, what impact does challenging behavior stemming from neurodiversity have on a child's learning and academic performance? And this is really important because parents are always very worried, especially parents who already have a diagnosis. There's that worry around, how is my child going to cope in school? Is the school provision going to be ideal for them? Would they be able to learn and all of that? So this question is, how does it impact their learning? And I suppose you can still tell us, how to help them in that whole process, really.
Thank you very much, Dr. Viv. When it comes to here in the United Kingdom, there is something called Code of Practice for SEND. Is a government guidance document released in 2015 to support schools in managing students, neurodivergent students, whether it's dyslexia, whether it's ADHD, whether it's autism, all forms of learning difficulties. Now, schools are expected to have an inclusive classroom, what we call quality first teaching, an inclusive classroom where every child matters and every child's needs are taken into account. Now, in terms of the impact of challenging behavior on learning for a neurodivergent student, I will not just say it's just for that student, because it could lead to disruptive behavior in the classroom that will affect the learning of other students as well, not just that one child or the two children in the class. So we think about the rest of the class and the impact a challenging behavior could pose in terms of performance, and then the teacher's inability to actually deliver the lesson they had planned because they're dealing with one behavior or the other and having to stop the lesson intermittently. To deal with that, we'll look at some strategies that have worked and are quite effective in coping and managing such behavior. Now, we must not label students, especially these neurodivergent students. The fact that they think they process information differently doesn't mean that they are not academically able. Like I said before, I have had the privilege of working with some of the most intelligent students in my 23 years of teaching, very articulate, high performing IQ, autistic children. Some of them, they pay incredible attention to detail, and dyslexic students often think outside the box. And they are so innovative problem solvers. It's because we box ourselves in the way we think and the way exams are run, especially in the UK. We believe that every child has to conform. And of course, when they don't do the exam in that particular way, that makes them a failure. No, we're actually diversifying the way we run our exams and the way students sit exams now. Thank God for technology. So they can actually have scribers, they can have readers, they can have all those provisions available for them in school to help them. Because we're looking at minimizing underperformance and also poor attendance, that it gets to a stage where a child doesn't want to go to school anymore. It becomes a school refusal because it finds a school environment not very conducive in meeting their needs, or they feel like they're being bullied because of their needs, or especially those ones who are not very expressive. They can't express their emotion. So those ones are actually the ones we tend to they go under the radar. We don't pick that up on time until it gets to a stage where the child refuses to come to school. So it can affect them. So at secondary school level, we talk about GCSE. Our GCSE results came out last week, Thursday, analyzing that and everything. That doesn't mean that they cannot achieve. They are achieving. They are. We just need to understand their strengths and work with their strengths and support them in those areas where they're finding, where they are, well, I don't want to use the word weaknesses, but where they are struggling, whether it's in literacy or numeracy, and put in place intervention strategies. Most of them would have what we call the EHCP, the Education Healthcare Plan, and with strategies that schools must comply with and ensure that these children are receiving the support they need so they can achieve academically. But one thing we cannot do is to label them and not identify potential barriers to performance, potential barriers to progress. They need to be identified. The teachers know their students. Okay, so the Senko's role, that's what the Senko's role is there for. Who are these key students in the school that teachers should be aware of, and what strategies or targets have been set in their plans that teachers need to be aware of to ensure that a classroom environment is inclusive and they're meeting the needs of these students in their lesson planning and as much as they can in their interaction with the children. So we can talk about so many other things as well, but of course, I'm conscious of time. Thank you.
Yeah, thank you. Thank you so much. That is really, really insightful. And everything everyone has spoken so far, what I'm gathering is that if you really want to support a child, any child at all, and then especially a neurodiverse child, you have to pay attention to the child in front of you. And not pay attention with them with a preconceived idea of expectations, but to look at that child and then keep asking yourself, what does this child need from me right here, right now? How can I support this child? So my next question is to you, Blessing, because I know that you have worked closely with children, supposedly children whom their parents might have lost hope in their ability to even start learning. So, my question is that as someone who has worked with these children, what are the positive support that the parents you have worked with put in place to help their children improve both behavior and learning, right? Because it's one thing to identify that your child is struggling, right? It's another thing to have the school supporting. What did these parents do? What are the things that they brought to the table that you collaborated with them, together, both of you worked together with, to then ensure that this child is improving in their behavior and in their learning?
All right, thank you. So the first thing I always will tell parents is you need to believe in your child and they need to know that you believe in them. Usually when we have kids, I work more with kids with dyslexia, kids struggling with reading. And usually when these kids come, we realize oftentimes, in fact, it's part of our curriculum now that we don't just start, with the intervention, but we start by first of all trying to figure out where their mindset is. What do they think about themselves? What's their self-esteem like? And 99.9% of these kids always have a very low self-esteem. And over time, we've actually thought, oh, maybe the low self-esteem is from school or peers who are saying negative words to them. But we've come to realize that even down to their families, down to their siblings, down to their parents, I mean, when you don't believe in your child, even when you don't say it, it shows. And I would like to say maybe kids have the power to know when people sincerely love them and believe in them or not. So no matter how hard your child is struggling with academics, struggling with reading, it is important that they know that you believe that they can. Because when you have lost hope on them, for most times that is where the negative behavior starts, manifesting, because they're like, well, I mean, nothing good can come out of me, so I can as well just mess up and do whatever it is that I want to do. So please, parents, no matter the struggles, no matter the disabilities, no matter the challenges, I mean, if you don't support your child, who else will? No matter the validation that they get from the teachers, it is so important that they understand and realize that no matter what, mommy loves me, daddy loves me, they're helping me, they are with me through all of this, and do it genuinely, from your heart. And then after you've established that, when it comes to managing behavior, I know that parents focus a lot on negative consequences. Oh, you didn't do this, so this is going to be the punishment. I would like to say you focus more on positive reinforcement, because the truth is, these kids do other amazing things, right? It could be as simple as, especially where we are here in Africa, it could be as simple as waking up and going to say good morning to you. Oh, thank you for coming to say good morning. Thank you for that. The work they did in school, whatever, any simple thing that they do should be rewarded. And when we talk about rewards, we're not just talking about you giving them candy, but affirming that, oh, this behavior was a good behavior. Please keep it up. Keep this behavior up. I have a student who each time we connect, I have to remind her to either say hello or turn on the screen. But a few days she has come in and she'll be like, hi, Miss Blessing, or she goes immediately and she turns on her screen. And I really do applaud that. I'm like, amazing. I didn't have to remind you. That's great. You did good today. So I don't have to wait until it's academics and say, okay, well, that is not reading. So, just let's put that aside. I'm only going to applaud you when you read well. So yes, you have times when you're giving negative consequences because they've not done well, but you should double, if possible, triple the reinforcement when they do well. I mean, you can just see how kids get excited when you applaud the little work they do. I mean, not just kids, Dr. V, even you and everyone on this call. By the time we applaud your amazing work, I haven't even done that yet, and you're smiling already. So you can imagine how that goes a long way for these children. So positive reinforcement is very, very big. And then I would like to say collaborate with the teachers. I think we're going to be talking more about teachers later, but we have strategies, scientific and research-based strategies that are used in school. And most times parents are going to talk to you about this and they might say, okay, we're managing this behavior and this is what we need you to do at the home front. Please take it seriously. Take it like your life depends on it. Don't say, oh, well, it's just behavior management. No, take it seriously. And if you have questions, make sure you ask. And then finally, model good behavior. For example, I know that when it comes to children with dyslexia, most of the challenging behaviors comes when it's time to do schoolwork, when it's time to do assignments. So how about having a time where everyone is doing their assignment or their work at the same time? For instance, if my kid needs to do his or her assignment, the television should be off at that time. The child shouldn't be at the dining table and then I'm sitting or the other siblings are sitting in the sitting room and having, dinner or gisting or watching the television. Let it be a time where everyone is doing something. I might not have an assignment, but I will decide that okay, we're doing this work by 8 p.m. I'm also going to be on my computer by 8 p.m. Everyone is going to be working at that point in time because most times kids who have learning difficulties tend to feel, oh, I worked harder because I'm not doing so well in school. Maybe that's why I'm doing my work at this point in time, and I don't want to do my work now. Or maybe they are distracted by what is happening, their siblings playing or watching TV or eating or the gist happening. So ensure that you have a time when it's time for schoolwork, when it's time for assignment, when it's time to do whatever it is that we need to do related to work. And strategies you'll be able to make some progress. But just like I said, we'll get to the part where we'll talk more about the teachers. It's important that as parents, some of the challenges that parents and teachers always have is that, oh, the parents are not working with us. How can we do this without parents? So very, very important. Thank you.
Thank you so much for sharing all of that, and I hope the parents here listening, I hope you're getting strategies that you can use. We're moving right into the strategies, and I'm coming to you, Damilola. And my question to you is, what strategies will you give parents for managing challenging behavior for their neurodiverse children? And I'm very, very particular about this question in the sense that let me just take a little bit of time to elaborate, right? I'm very particular about this question in the sense that we have to come from a place of understanding, because if we're saying that neurodiversity is a diagnosis, right? Which means, like we have said so far, that most, if not all of these challenging behaviors cannot be helped because there is something going on, right? How then do we manage? Because it's different when I know that a child can help the situation, right? Or a child has the ability to actually help the situation and manage the behavior, right? But if we're saying that this child has a diagnosis that is causing this challenging behavior, what strategies then can I use to support that child, so that we can improve the behavior, we can thrive, we can work better. Dami, that's your question.
Okay, thank you again, Dr. V. First of all, the first thing I would want us to think of is building a positive relationship. How do we do this? We connect through interests. Most times, it's always about the adults or other people around. But if you want to manage challenging behaviors appropriately, you have to connect through interests. Spend time engaging in activities that your child enjoys or that this neurodiverse individual in your life enjoys. Build a strong bond with them. If you have a strong bond, if there are a positive relationship between you and your child or this individual, it makes it easy to address challenging behaviors when they occur. Blessing already touched on this one. Consistent positive reinforcement encourages the children to repeat those behaviors. So instead of focusing on when the challenging behaviors are occurring, how about we focus on when they're doing something great, something extraordinary in our own definition, and then, anchor on this, acknowledge the effort that they put in to engage in the behaviors that we want to see at the time. That way, we are more on the positive side than emphasizing on the negative side. Also, we have to understand and anticipate triggers, right? How do we do this? We identify patterns. We observe when and where challenging behaviors occur. Look for the patterns in these environments. It could be sensory inputs or transitions that might be causing stress. If we identify these patterns, it makes it easier to make some changes that would then help with reducing the challenging behaviors. Once triggers are identified, then you modify the environment or routine to minimize these triggers. That way, it's no longer about you. It's now more person-centered and saying, okay, this is difficult for this child. What can I change in the environment? What can I do to make it better? What can I do to reduce the stress or the frustration that this child is experiencing? If we look at it from the child or the person, the person's approach, then it makes it easier. It's not about you're stressing. No. It's about reducing the kind of stress that this individual is going through. You could also set clear and consistent boundaries. Establish a predictable daily routine. I mean, think about even neurotypicals, as so to say. When we're starting our day, you've written it in your to-do list. I'm doing A, B, and C, and then something comes up out of the blues. It's kind of disrupts the plan. We're not always happy with that. So why should it be different? Let's establish a predictable daily routine. There are some things that are consistent. That way, it minimizes challenging behaviors for the neurodiverse universe. Simple instructions will also help. Give clear, concise instructions. There are times that someone says something to you and you're wondering, what exactly do you want me to do? Right? And then you're having to think it through and the likes. Why put these children in through that kind of stress when you can always give the clear and concise instructions? And if it requires visual aids, let's use it. Charts, social stories, anything that would make the neurodiverse individual understand the expectations. This will reduce any form of challenging behaviors. We can also teach and practice self-regulation, calming techniques. Teach this individual how to calm themselves in different situations. You could use deep breathing. You could use a fidget tool, or retreating to a quiet space when they feel overwhelmed. There are times you find yourself in gatherings and some things are happening. You just stand up and go to the restroom. These are calming techniques that we engage in. So why shouldn't we put such in place for neurodiverse individuals? Emotional literacy is another thing. Help this individual to identify and express their emotions through words, pictures, or other forms of communication. Whatever form of communication this person uses, then that's what they should use to express their emotions. Because this way, it's easier. This person can say, oh, right now I am sad. Right now I am happy. Right now I am frustrated. And if they are able to communicate it in whichever way that works best for them, it reduces them engaging in challenging behaviors. We could also think about offering choices and control. Empowerment through choice. We don't have to choose for them every time and say, this is what you must do. No. Empower them through them making their own choice. Let them have a sense of control over what happens to them and with them. For instance, you're asking a child to do their homework right now, and the child is finding out. Then you could ask them, would you like to do your homework now or after a snack? So that way they have some form of control over what they are doing and over what is happening to them. And because you have offered them choice and they've made the choice now, then they know that after this snack, the next thing is my homework. It makes it easier for them. And then allow flexible responses, really. Be open to adjusting expectations based on the child's needs and preferences. Nothing is cast in stone, so we shouldn't treat it as such. So when they are struggling, let us be open to what works best for them at that time. Let it be child-led, individual-led. It's not about us, the practitioners or professionals. It's about this individual who is experiencing the frustration, the hurt, and everything. So we should take that into cognizance. And then consistent follow-up as well. Let's be consistent. Expectations should not be changing every now and then. let them know that in this situation, this is what is expected. It's not that today you say, when you want to greet me, say hello, miss, and say sentences, and then another time you're expected to say longer or shorter sentences. You want to keep the expectations consistent so that they know how to navigate some situations that they find themselves. Some sensory tools too could help. You want to provide sensory support, right? Provide tools that can help these individuals manage some sensitivities. If you know a child is sensitive to loud noise, you don't have to expose them. You don't have to force them to be in the situation where the noise is too loud. You can give them noise counseling headphones, weighted blankets, or chewable jewelry, because some behaviors are sensory, gives them some form of sensory feedback. You can't take it off all of a sudden. Instead, provide an alternative support that will give the same sensory feedback that they get from the challenging behaviors that we say that they exhibit. We want to also adjust the environment, modify the home environment to reduce sensory overload, right? Then incorporate visual support, visual schedules. This is what the child is expected to do. Let them be able to visualize it. Let them be able to see it so that it is more concrete for them as against it being abstract. We could also use social stories to explain social situations and appropriate behaviors. This way, the child can relate with it because they can now picture whatever it is that is expected of them, and then be able to replicate it when they find themselves in the situation next time. Another thing that is very, very important is that parents to collaborate with professionals. The therapist is working with your child, the special education professional, you want to collaborate with them. So when they say, oh, this is what we're working on, we want you to replicate this at home, following through will help the child reduce challenging behaviors. Training and education, you want to keep abreast of, recent developments, researches, and the like, so that you know what to do. You want to be patient with your child. You want to be patient with yourself. That they are not doing something right now doesn't mean they won't be able to do it eventually, right? Be patient, be flexible. They don't have to do it right now, and they can do something else before coming back to whatever it is that is expected of them. That way, it makes everything comes from a place of understanding. And then you say, oh, I see you, I understand you, I acknowledge you, and I am willing to support you to thrive. Thank you.
Thank you so much, Dami. I mean, someone is saying in the chat that we need a tip sheet for all that you have shared. And I agree, because you have shared quite a lot and we really need to articulate them and put them down. Thank you. Thank you for that really, really, really in-depth, explanation about strategies that we can use, in the home to support our children's challenging behavior. And one of my key takeaway from this is for us to understand that these challenging behaviors, they're not just coming because your child just wants to, right? There are things triggering them, things and situations that your child cannot help. So when you put yourself in that mind space, it is easier for you to then show up for your child to say, okay, let's walk through this together. We must always remember they cannot help it. That is why it's happening. Do you understand? So my next question is to Lovett and Blessing. And the question is, what strategies are used for managing challenging behaviors in the classroom for neurodiverse learners? Because I know that it's going to be a crossover of some of the things that Dami has shared,
Absolutely.
but really then applying it, into the classroom for a teacher who is listening and wondering, how do I use this in my classroom?
Absolutely, Dr. Viv.
Yeah.
Absolutely. There is just overlaps, because when Dami was talking, I was nodding my head, because some of the strategies she was sharing is exactly the similar strategies that we use in schools. The only what she flagged up as well is the fact is consistency. Where it all breaks down in our schools is where there is no consistency at all, where one teacher is doing something and another teacher is doing something totally different. So, and the child learns to manipulate situations, and that doesn't help at all. But if all the teachers are speaking the same language and singing from the same page, then it builds that consistency in terms of high expectations, in terms of praise, but also that does not excuse poor behavior. Knowing where the sanctions, when to apply the sanctions, but understanding the child, first of all, having firm boundaries and routines, and actually having that reverse psychology, reinforcing the positive behavior and focusing on the positive. The government expects us in schools to actually do what we call to make reasonable adjustments in our classrooms to support neurodivergent students. So if it's a dyslexic child, for example, we know we should provide colored paper for them, and then we provide a quiet room for students identified with neurodivergent students, providing them with a quiet room to sit an exam because they get overwhelmed in the hall with the other students. So the students who are prone to anxiety and stress because of their learning difficulties, they actually have that provision. So schools have different provision, including giving them access to the dining hall 5 minutes earlier than the others, as long as they do not abuse that privilege. If that happens, it gets taken away from them following a meeting with the parents and discussion with the Senko. So again, the schools have all that. Now we've talked about Dami has talked a lot about cards, what parents can do at home. That's similar to what we do in school, providing toilet cards, providing access to a quiet room, providing extra time for tests and exams, and then giving them visual timetable that they can see actually, so they can organize themselves better. And sometimes we give them sensory fidget toys, and teachers are aware of that because it's on the child's, it's part of the child's plan, EHSCP plan, or their one plan, or their support plan. It's in the plan, so teachers are aware of that. The fidgety toy is not for the child to play with in the classroom or disrupt learning with that, but it's just to allow them to calm them down, especially when they start getting a little bit stressed. So as long as the child is not abusing the provision given to them, it works seamlessly well, and that is communicated to the parents as well during their meetings with the Senko or with the head of year or with a classroom teacher, if it's a primary school setting, or whoever the contact member of staff is in school, working with these students directly. And in most cases, it's always the school Senko, the special educational needs coordinator, the Senko, who oversees all these provisions and the targets and the plans. So it's important that there is just that consistency of action, that what's going on at home mirrors what we're doing in school. So the child, there is no room for confusion, and there is no room for conflictual messages being sent to the child. So once that is the case, because sometimes we notice that, okay, we're trying to reinforce boundaries and everything, but that's not what's happening at home. Then there is breakdown in communication for this neurodivergent student, because they're seeing that, okay, at home it's different. The child is allowed to do what they like. There are no boundaries at all, because for so many other reasons, that we may not even begin to understand. Some of them have very complex needs, and then home front can be quite difficult and challenging. So when the child comes to school, they expect the same treatment, to be allowed, no boundaries, to be allowed to do anything they want. So again, that is where homeschool communication becomes very important for us, and we're going to look at that next. Homeschool communication. What can we do? How can we work better, and not better, but how can we work more effectively with our schools as parents to actually support our children at home? Thank you.
Thank you. All right. Blessing, I'm going to ask you to add something from a different context, to this, before I then come to Lovett to quickly just give us that homeschool, because I'm a little bit weary of the time. We have a lot of questions in the chat, so that we don't keep us for so long. So Blessing, if you would quickly add something, and then come back to Lovett to round off with that homeschool collaboration. Please.
All right, thank you. So everything has actually been said. So I'm just going to stress a little bit on the clear instructions part, especially when you're working with kids who have learning difficulties. It is super important that you're clear with your instructions. Earlier, Lovett started talking to us about executive function, which is one of the challenges that kids to learning to have. I've had situations where I gave an instruction and either the child didn't obey or did it wrongly. And I was wondering why. But after reviewing, I realized that they didn't even understand the instruction. For instance, I said, okay, this is your assignment, submit it by this time. And I was like, okay, let me ask, what was your assignment again? And the child said something totally different. So imagine they did exactly what they were thinking. I would have been angry. I would have been like, no, this is not what I said. You submitted your work late. Oh, you're going to get this consequence, or you're going to get this punishment. So you want to, first of all, ensure that they understand the instruction. The instructions should be clear. I know classrooms also have rules or expectations, whatever they are, make sure they are clear. And one way you can know that it's clear is to ask the child to say them. So whatever they say is what they are thinking. Constantly always ask them. If they say it wrongly, you correct them over and over and over again. For every other part, we've done a lot of justice on it already. So thank you.
Thank you. Thank you so much for that input. Really, really important to reinforce that. Really important. Lovett, do you want to share quickly, just run us through that homeschool collaboration, especially for parents in the UK who are wondering, how do I speak to the school? How do I collaborate with the school? The school is coming back to me to say my child is struggling with their behavior. We can no longer cope. What do I need to do to ensure that my child stays and thrive in school?
Thank you very much, Dr. Viv. Now, the one thing parents need to understand is that every single school has got what we call the SENCO, the Special Educational Needs Coordinator. Whether it's primary school or secondary, we do have a SENCO in the school, and they are trained to actually deal with neurodivergent students and to support teachers in their classroom practice to ensure that the needs of these students are identified on time, early interventions are put in place, and that any inhibitive barriers to progress are actually flagged up on time and dealt with effectively. Now, parents, on the other hand, I always say to them, please read the school's policy, the SEND, know who the school SENCO is, know who is supporting your child, who is working with your child directly, and also know who is if your child's medical needs, make sure the school is aware of them. Any medical information you have about your child from primary school, and then when they move to secondary school, that the secondary school have that information as well. Behavior and discipline, the school's policy on behavior and discipline, who are the school's pastoral teams, who are they? If your child is in year 7, who is a year 7 head of year, who is your child's direct form tutor, and who are the other members of the pastoral team that you need to work with, including the senior staff in the school. The inclusion department is very important because that's where the SENCO leads up on the inclusion department, and you have teaching assistants, and you have, I talked about readers and scribers before. They're all teaching assistants, included before, when schools used to have a lot of money. When I started teaching here 23 years ago, we had speech and language therapists in our schools. We have mentors in our schools. We had education psychologists in our schools. We really had that to meet the needs of these students. Unfortunately, due to funding, financial constraints, we are quite limited in what we have, but schools work together, school to support, to ensure that we are still benefiting from these services and for the benefit of the children. Uniform, some schools actually provide uniform for the children, and then of course the attendance is being looked into on time, the school's attendance policy. And if your child begins to say they don't want to go to school anymore, act immediately. Don't just allow them to have a lie in because they don't feel like waking up and going to school. Work with the school. If the child has a plan, and they should have a plan with a target, HCP plan or one plan, please make sure that you meet with the SENCO to know when is the review date for the plan, when are the plans going to be reviewed, what are the targets set for my child. These targets, have they been communicated to the teachers? In which subjects is my child struggling with the most? And then perhaps you feel overwhelmed when teachers are calling you all the time. So, some teachers may call with a positive phone call, it may be negative. Then you can request that actually to have just one contact person okay, contacting you. Could be the child's head of year, or it could be the SENCO or a teaching assistant, an adult in the school, agreed by the school. So the teachers don't overwhelm you with phone calls, especially if the behavior is posing some challenges. They don't overwhelm you with phone calls at all, but you just have one person you're liaising with all the time. So these are strategies. It's actually about one thing we should avoid as parents is to disengage with the school. Please. Instead, let us do the opposite. In the best interest of our child, let us engage with the school positively and effectively, understand the school's point of view. And when the school is getting it right, let us praise the school, because sometimes as parents, we're so good to criticize the schools and not understanding that we do have very limited budget and funding for a lot of things we have to do. But praise the school when they get it right, because at the end of the day, we are working for the child. It is in the best interest of the child. And we have to ensure that we are giving the child that holistic development that they need to thrive and flourish in the society. And that's what we're working. But it's a partnership, and we cannot neglect that partnership. Thank you.
It is a partnership for the best interest of the child. You cannot afford, whether your child is neurodiverse or not, you cannot just afford to leave them to the school. You have to be there. You have to be in the faces of the school. In fact, the school should know that this particular parent, if anything happened the next minute she's in school, that is the kind of parent I am. So there are things that cannot happen to your child when you're like that. There are some negligence that cannot occur when the school is aware that you are a hands-on parent. So it's a partnership, and you just have to make that effort. I'm really, really mindful of our time. We've overshot our time by 13 minutes, but we have some questions. We're going to take a few questions. I'm shooting for us to be out by 7:30. So let's quickly take a few questions, and then we'll call it a day. Please, if you have a question, drop them. Even if we don't address your question in this session, we're going to address them. We're going to take them and address them eventually. But I'm going to make an effort. And please also put an eye in the chat if you have enjoyed this webinar. If you have enjoyed this session, if it has been impactful to you, please kindly take a survey for us. This webinar is funded, and we need to prove to our funders that it is making the impact that we've promised them that it will make. So kindly help us. Use the links in the chat, take the survey, and tell us how this webinar is. Give us a real feedback of how you felt about the webinar. So one question here is, and any one of you, just let me know, anyone that is comfortable to take any of the questions. One question here is, what do you do if your child becomes physical with you? Example, kicking, punching, biting you, which is really very common, especially when they're overwhelmed and when they are struggling. So what do you do? Please, who can help us? Blessing wants to go. Blessing, please.
Okay, I would like to start, and then the rest can add. I saw this question earlier, and it reminded me of it that I had before. So usually when a child gets to that point where they are getting physical, I like to talk about the ABC of applied behavior analysis, because the first thing you want to find out is why, what happened. It is so important. Most times we avoid that when it comes to behavior management. But you can't talk about behavior without talking about something that influenced that behavior, either positive or negative. So if this child is getting physical, if this child is hitting, you want to have the record on ground. What happens just before that child hits? What happened just before that child kicks? What happens just before that child bites? If you're able to figure that out, I want to assure you that you already have about 90% of the answer to your solution. Now I'm going to give an example. We had this student I was working with, and some days there were terrible behaviors, biting, kicking. Some days the child is sweet, and we're like, what is going on here? We decided to start recording the days that this child would kick and bite. Guess what we realized? That anytime the child wears a long sleeve, there's a sensory overload and they just start hitting, biting, and any slightest thing just gets them angered. We're so amazed. We're like, really? All of this just because you wore a long sleeve, and all we have to do was tell the parents, you know what, ensure that this child is always on a short sleeve. Of course, this might not be the situation with your child, but that is a good way, to start in finding out. I'm sure the other facilitators have more to say.
Does any one of you have something to add? All right, love it, please.
Quickly, yes, quickly. Actually, we noticed some similar things as well with some of our neurodivergent students in some of my schools. That one of them in particular, we realized that when doing transition activities, because they were not aware that those activities were going to take place, they kick off, swearing, tantrums, really massive tantrums. Then when we began to, what happened, the head of year did what we call a round robin to find out from the teachers, exactly feedback from the teachers, their observations. And based on the round robin, the report from the teachers, we noticed that this actually happens because of that, the cause and effect. When the child is unaware of transitional activities in the lesson, they kick off. It creates stress and anxiety for them.
Yeah.
So again, tell teachers, the pastoral team, they have what we call the referral to inclusion department. So when teachers observe certain things, even if a child has not yet been diagnosed as being a neurodivergent student, we refer to the inclusion team because other teachers may have picked up similar things as well. So it creates a picture and actually triggers a conversation to get that child diagnosed and get them the professional support they need.
Thank you. That would lead me to the next question. But what I hear you and Blessing say is that you just need to pay attention to what is going on, because if you want to deal with that behavior, whatever behavior you're seeing on the surface is triggered by something. So if you want to actually address that behavior, what you need to do in the event of that behavior is, first of all, protect yourself and make sure your child is safe. But then to actually deal with it properly, you have to pay attention to what the underlying cause or what the trigger of that behavior is. Because if you're able to remove the trigger, then you're able to address that behavior. Thank you very much. The next question says, how do you support who you suspect is neurodiverse? So if you suspect a child is neurodiverse, but you don't have a diagnosis, do you recommend always getting a diagnosis? And this question is super important, especially for those of us who are in the UK, understanding what the backlog is and what getting diagnosis is, the stress around getting diagnosis. How do you recommend that, a parent deals with this? They suspect their child is neurodiverse, but they don't have a diagnosis. How do they go about that? Yeah, Lovett is for you, really.
Oh, sorry. Okay. Yeah, we do have cases like that in school because sometimes some of our students don't meet government threshold to qualify for professional aid and support. So we have to deal with that in school and we don't get funding for it. So we do what we got. Again, it's back to what I said earlier about quality first teaching, about making those reasonable adjustments. But again, observations, you've observed, follow the school structure and systems in place, referral to the inclusion department, speak to the SENCA, don't wait and talk about it in the staff room and then think it's all going to go away. And everybody talks about the problems or challenging behavior that student is exhibiting in lessons. It may be actually the after lunch break or just before, whichever period of the day. But use the school system, the referral, it's very important. Fill out the referral form. And then my concern, schools have what we call my concern, way of recording safeguarding issues as well. They use different systems. Some schools use my concern. Some schools use CPROM. Some schools use EduKey. So you use the school system to actually record your concern because that will be picked up immediately by the safeguarding team, picked up by the SENCA. And then they now do what I said earlier, the round robin, to find out exactly if these observations and behaviors are consistent everywhere. Then they now put in place, invite the parents in to find out exactly if parents also have noticed a similar behavior patterns at home. Or are they just in school? In some cases, yes. In some cases, no. So whatever happens, we actually support the child. So the Senko now works with the entire staff at a whole school level. That's identifying the barriers, identifying the problem, and also the support we can give. It can be actually fidgety toy, sensory fidgety toy, and it can be actually giving them 5 minutes, allowing them to leave the classroom 5 minutes early, so they can go to lunch break or they can go to their next lesson, to avoid a crowd in the corridor during lesson changeover that could trigger some anxiety and stress. So we put in place really no cost at all, but strategies to support this child in helping them to settle. It could be comes to organizational skills. It could be actually every morning they have a contact adult they meet with every morning who goes through their planner, their school book with them and everything they need to make sure that they're ready to learn for the day. Just little adjustments we can make massive difference in the life of a child in a day, in a child's life. Thank you.
Thank you so much. And I'd like to, add to that by saying, don't focus on diagnosis, especially if you are in the UK, right? Or wherever you are. Don't just say, oh, until I get diagnosis. It is paying attention to the needs. What does this child need? How can I support these needs? If you know what your child needs, communicate it to the teacher. This is what I'm noticing at home. This is what has worked for us. This is what I'm doing that is helping. And let your child get the support that they need in the interim until you're able to then get a formal diagnosis. It's really about supporting your child to get the best they can while you're getting the diagnosis. Doesn't really change anything. It's just the diagnosis is just for you to know and affirm that this is the name of what is going on with my child, but the needs will not change. Pay attention to those needs and find a way to meet those needs as you go day by day with your child. Unfortunately, we won't be able to take more questions, but there's someone in the chat collating the questions. So we would respond. We will send it to our facilitators and they will send us a response and we'll share it with you. If you registered for this session, you will get the recording. If you didn't register, please, I don't know, find the link and actually register, because some people joined with just the Zoom link, right? So if you registered, we would email the links to the recording for you, and you'll be able to catch up with the recording or anything that you missed, and we'll be able to add some of the responses to that email that you also get. Please don't forget. Bumi, can I have the announcement? Please don't forget to take the feedback. Please, this feedback is really important. We want to hear from you. We want to know what you learned from this webinar. We want to know what you want us to improve in our coming webinars. Remember, I told you that this is a 6-part webinar. So this is only part 2 out of 6 of the webinar sessions that we're having. Bumi, someone is asking that if they couldn't register on Eventbrite, what should they do? Please kindly respond to them in the chat. So we have parent resources, right? If you look on your screen, you will see a QR code and a link, right? So please scan the link. There are amazing resources on our website for parents. There are the past webinars are on the website, right, that you can catch up with. Some of our facilitators have graciously shared resources with us that we would also put on the website, some of the things that we're learning here. And for the person who said we need a tip sheet, right, we're going to create that tip sheet. I'm sure that our facilitators will be able to provide us, some of the answers that they have shared with us today. We'll create that tip sheet. It will also be on this resources page. So if I were you, I will scan it or I'll copy the link and keep it somewhere, so that I can keep on going there to see all the amazing resources that we have on our website. Umi? Okay, so we also have a WhatsApp group. We provide support for families with autistic children, especially if you are in the UK. We do sessions, we do signposting, and we provide resources in our WhatsApp group. So it will be very, very good if you will join our WhatsApp community. If you are on this chat, kindly look at the chat box right now and click the link and join that WhatsApp community. I'm waiting for you in there. As soon as this ends, I'm waiting for you in there to welcome you. So join that WhatsApp community. We share a lot of resources, helpful information that can help you and your child or the child you're working with navigate the challenges of being neurodiverse or being specifically autistic. It's not just specifically autistic, mainly autism, but any other form of neurodiversity, really. Just join the group and share it with any family that you know that might benefit from that. Also, we have something that has been going on for the whole month of August, which is the Summer of Kindness Challenge, where we are challenging our young ones to participate in acts of kindness throughout the month of August, right? And it's not late if you want to still participate. All you need to do is to click the link and join, download the sheet, follow the instruction, download the sheet, engage your child, right? If you visit the website with this link right now, visit that website, download the kindness checklist, engage your child. If your child has done any of these activities that they're supposed to do one every day, tick it out. If you can still do them, if they haven't done them and you can still do them, please let them do it and tick it. Then submit the completed kindness checklist to get a kindness certificate, right? What does that do for you? When you get that certificate, your child can go back to school with it. They will be celebrated. It boosts their self-esteem. This is also something they're doing that improves and impacts positively, to themselves, and, shows them a sense of contribution that they can make in their community, right? So, and they can also stand a chance to win other prizes. There's a cash prize, there are other amazing prizes that, they can win, So it's really a good way to get your child to participate. As they resume school, they have that certificate that they can celebrate with their teachers as they resume school back in September. So get your children to participate. This is a way of also teaching them value as well, the value of kindness. Yeah. So this one is a research that we're conducting, and this research is really, really important, especially if you are in the UK. One of the problems or the challenges that we have noticed our young people from African and ethnic minority backgrounds struggle with is their racial identity, right? They struggle with their racial identity. And this is something we want to investigate further so that we can better understand how it is and how best we can support our children, because we have found that there's a lot of racial socialization that is going on, and this impacts on our children's mental health, impacts on how they see themselves, impacts on how they respond, impacts on their self-esteem and all of that. Please, we want to hear from you. There are questions that we have put together. These are just questions that will take a few minutes to help us conduct this research, right? So please, if you have children, just scan this, answer the questions for us, and submit it back. That's all we need from you. It will help us with our research that we are conducting. Thank you very much. Please, and go ahead, follow all our social media handles. We are on LinkedIn, we're on Facebook, we're on Instagram, we're on Twitter as Afrikindness. If you have any question, any information, anything you want to share with us, anything you want to ask us, just email us at info@afrikindness.org. If you work with neurodiverse individual, your special education teacher, you want to volunteer, you want to give back to your community, you want to contribute, just like myself and Lovett, we are volunteers at Afrikindness, and we absolutely enjoy what we're doing. We're absolutely enjoying the contribution that we're giving back to our community. Please, if you want to join us, just send us an email, info@afrikindness.org. Join us to do the work that we're doing, and we would welcome you with open arms. We look forward to seeing you, meeting you, and including you in what we're doing. And again, this is our webinar, our 6-part webinar series. The next one is coming up by the end of September. And just look out for our email. It will come into your email. And that webinar is around communication in autism. If you have heard or if you know anything about autism, you would understand that there is that struggle in communicating or understanding what your child is trying to communicate. So we want to demystify that. We want to show parents and teachers how to understand, the communication from autistic people and how best to communicate with them, right? And we want to thank our funders for this particular project, because without them, we wouldn't be able to bring this to you at no cost at all. This Afrikindness Neurodiversity Community Program, which is geared at bridging the gap in awareness and support for African and ethnic minority communities with families with neurodiverse children, is proudly funded by the Leeds Community Foundation and the Sir George Martin Trust and we thank them. We're grateful to them for this opportunity, for providing the fund for this. Please say a big thank you to them in the chats. We're all beneficiaries of their fund and the work that they have helped us to do. And finally, I want to say amazing thank you to our facilitators. Thank you for sharing your time. Thank you for sharing your expertise. Thank you for sharing really in-depth answers, right? To all our questions. I really enjoyed every bit of it. I myself, I also learned, and I'm sure that everyone on this chat has gotten something that they can take away and apply and implement either in their classroom or at home to support their children. And it is our joy that children in our community who are differently abled are able to be included, and that we can help them and support them to thrive as they navigate through their life. Thank you once again for making this possible, and God bless every one of us. Thank you for coming. Thank you for our parents, our teachers, our professionals who are in the chat. Thank you for making the chat buzzing, right, with your questions, with your contribution. I saw all of them. I'm so sorry I couldn't take all the questions, but thank you for your contributions. We really see them and we appreciate them. Thank you so much. And that would be all for this evening. See you again next month for the next session. Thank you. Bye.